In a healthy temporomandibular joint, opening and closing the mouth involves smooth, coordinated movements without pain, discomfort, or abnormal sounds. The first part of opening the mouth involves a hinge-like motion of the TMJ. The condyle, the rounded end of the lower jaw, rotates within the mandibular fossa, which is the socket in the temporal bone of the skull. This initial movement allows for the first 20 to 25 millimeters of mouth opening. After the initial hinge movement, the condyle and the articular disc, which is a small fibrous cushion within the joint, slide forward along the articular eminence, which is a bony ridge in the temporal bone. This sliding action allows for further opening of the mouth, typically up to about 40 to 50 millimeters in a healthy adult. The movement is smooth and controlled, with the disc remaining properly positioned between the condyle and the temporal bone. When closing the mouth, the process reverses, starting with the condyle and disc sliding back along the articular eminence into the mandibular fossa. The movement is smooth, ensuring that the disc remains properly positioned to cushion the joint. The final part of closing involves the hinge motion, where the condyle rotates back to its resting position within the mandibular fossa. The upper and lower teeth come together in a precise and controlled manner without any deviation or misalignment. The teeth coming together into occlusion support the condyle in its seated position. This is an important key to a healthy TMJ and often missed when assessing the TMJ and the possibility of a disorder. If the posterior teeth do not support the condyle in a seated position in a currently healthy TMJ, it is highly possible that a disc displacement will eventually occur, and it's discussed in the next part of this video series. So the characteristics of a healthy TMJ include smooth and pain-free movements which occur without pain, discomfort, or resistance. Movements that are symmetrical. The jaw opens and closes symmetrically without deviation to one side. There are no clicking, popping, or grinding sounds during movement. And the mouth opens fully, approximately 40 to 50 millimeters without restriction or difficulty.